Hi, everyone. My name's Lauren Crowd, and I'm one of the Parkland Emergency Medicine resident physicians. I'm also the moderator for this session today, working alongside these emergency medicine faculty physicians. I wanted to start out with asking Dr. Isaacs a question. Why are we taking the time to produce this video today for all of our first responders?
Well, that's a great question, Dr. Crowd. Hello, paramedics, EMTs, firefighters, and officers. For those of you who don't know me, I'm Dr. Marshall Isaacs. I have the honor and privilege of serving as the medical director for the UT Southwestern Parkland BioTel EMS system. For the past 10 months, SARS-CoV-2, the novel coronavirus, the virus that causes the disease we know as COVID-19, has significantly impacted the world, the United States, Texas, and each of our EMS agencies. While many have had mild symptoms, some have had long-term symptoms, some have required intensive care, and unfortunately, some have died. Today, we have 2 safe and effective vaccines, and I am optimistic that in time, over the next few months, these vaccines will help bring an end to this pandemic. In the meantime, it is critically important that we all continue to rigorously practice infection prevention measures, including physical masking, physical distancing, hand hygiene, and limiting indoor exposure to those outside your immediate household. Now, in the next few weeks, you will learn of efforts by the medical direction team, as well as fire chiefs and command staffs, city and county leaders in collaboration with our hospital partners to begin vaccinating our EMS professionals. We'll begin with our frontline paramedics and EMTs, followed by non-transporting EMS and fire department members and officers, and eventually our law enforcement partners too. We are here today to provide you with a no-nonsense explanation of the science of vaccination. After all, a vaccine is only as good as those that agree to be vaccinated. So when you hear that it's your turn, we hope that after today, you will step up. In a war, we must protect the warriors. This is our time. Let's protect ourselves, our families, our colleagues, our departments, and our cities. Dr. Crowd.
Thank you, Dr. Isaacs. Moving on to Dr. Morchetti. What exactly is an mRNA vaccine anyway?
Yeah, that's a good question. You know, it's probably one of the coolest things that I've read about in a long time in medicine. And as you know, there's new innovations that come out in the House of Medicine all the time. Messenger RNA, that's the M in the mRNA, is something that's actually been around since the 90s. They really put a lot of effort and finances into it this year due to COVID, about $12 billion in fact, and it really is a testament to what we can accomplish when we all work together. But what messenger RNA is, it's a little snippet of almost like a blueprint for how to build something within our cells. And in this case, the scientists were able to figure out how to build the spike protein, which is on the outside of the coronavirus, which is what allows the coronavirus to gain access into our cells and infect us. They were able to figure out the blueprint for that and put it inside a messenger RNA in a little capsule and turn that into a vaccine. And then that messenger RNA enters our body, goes to our cells, and produces this blueprint. And that blueprint just teaches our cells how to make these spike proteins. These spike proteins are dirty little jokers, and they are showing themselves to our immune system, and our immune system recognizes them as foreign proteins and builds up a defense against it. So the messenger RNA, it's nothing more than a blueprint. It's not something that's embedding itself into our DNA or into our genetic code. Or something that hangs around even. It's actually pretty fragile, which is why it's been so challenging to get it to work over the last few decades. But like I said, when you take half the world's scientists and $12 billion and everybody kind of all hands on deck, they were able to figure out how to make this thing last long enough to get into our cells to do the work that it needs to allow our immune system to come out pretty strong and have this defense. After the messenger RNA delivers that message to the cells and the blueprint, it breaks apart and is gone. You know, just like when you build a piece of furniture, you don't need to keep the plans afterwards. You just get rid of them. So all that's left after the vaccine has done its job, all that's left is an immune system that's prepared to fight COVID when it sees COVID.
It was a great explanation. Thank you so much, Dr. Morchetti. So, Dr. Brian Miller, wasn't this COVID vaccine developed too quickly?
So that's a great question. I think it's one that is on most of our minds of, did this happen too fast? And so you have to really go back into the history on this, as Brandon already alluded to, and that this has really been going on for about 30 years already. And so the scientists worked on this through the original SARS that was in Asia, as well as the MERS in the Middle East. Even in cancer research, they've been working on the mRNA vaccine and technology for a while. And so they had a lot of the pre-work already done for this. And so then by the time we got to SARS, they weren't trying to reinvent the wheel. They were literally just trying to change the hubcap to match the COVID virus at that point. And so that was why we were able to do this so fast. So we figured out what the genome or the DNA was of the virus as soon as it came out in China. And then the scientists just leapt onto that and rapidly developed the mRNA for the COVID virus. And so we really were not rushing it. We just were well prepared to this point. And I think fast is not bad. Ultimately, fast is a testament to our technology and kind of a bright future for us that we're going to be able to create vaccines much faster.
Great, thank you. Dr. Salazar, what about those who think that the vaccine hasn't been adequately studied?
Thank you for that question, Lauren. It's a pretty valid concern. As my colleagues before us said, a lot of the groundwork was already done ahead of time. So I wish to remind folks that the process for developing this vaccine still went through all the required phases, the first 3 phases specifically, which every single vaccine you and I take right now are required to go through. The difference between this and other vaccines, which take many more years to develop, was that the process was expedited, not rushed. There is a difference. A lot of the roadblocks that traditionally keep a vaccine from being developed, studied, manufactured, and distributed were taken away very quickly by governments, by scientific institutions and scientists themselves. We had no lack of volunteers, and all the governing bodies, including the Food and Drug Administration and the CDC, were very prompt to look at the data and allow us to distribute the vaccine. So therefore, it's a vastly big difference between being rushed and being expedited, but still no corners were cut in terms of developing the vaccine.
Great, thank you. Dr. Ronna Miller, shouldn't people in the vaccine studies have been followed longer before they released the vaccine on the public?
Thank you for the opportunity to participate here today. That's another great question, and the answer follows directly from the information that was already provided by Drs. Morchetti, Miller, and Salazar. Much of the science had already been completed before work on the vaccines for this specific virus began early in 2020. So we already had a head start on the process. Now, when it comes to both efficacy and safety, there are reasons why things moved very quickly. For efficacy, in order to test whether a vaccine is protective or not, there needs to be enough of the illness, in this case, the virus, in the wild, in the community, so to speak, in order to determine whether vaccinated individuals are indeed protected. Because the virus that causes COVID-19 is so globally widespread everywhere on the planet, this phase of the vaccine trials moved relatively quickly. In other words, we were able to determine within a matter of only a couple of months whether, in fact, those who had received the vaccine versus the placebo were protected against serious illness. From a safety standpoint, most vaccine adverse reactions, as we'll talk about in a moment, occur within minutes to hours after vaccine administration. So if there were to be safety issues in terms of an allergic reaction or other adverse effect, those become apparent within minutes to hours of the vaccine administration. And certainly following the study participants for 2 months was adequate from this standpoint. But all of the study participants, and indeed anybody who gets any of the current vaccines, will be followed, and any adverse effects would be reported.
Great. Thank you so much for answering that. So, Dr. Morchetti, I've heard that this vaccine can alter your DNA, or that you could maybe pass it down to your offspring. Is this true at all?
Yeah, no, I've heard that too. And I'm here to tell you that this is absolute nonsense. It is physiologically impossible for a piece of messenger RNA to embed itself into your DNA. It does not affect fertility. You cannot pass it down to your offspring. It will not touch your genetic code.
So, Dr. Brian Miller, another question that I know looms around the idea that the vaccine could possibly create an autoimmune disease. Do you mind elaborating on that for us?
Yes. So the vaccinations as a whole, even since like the 1970s, this has always been some concern. And so an important thing for everyone to remember is that there is a baseline rate that people get neurological and autoimmune things all the time, whether they get the vaccine or not. And so that will still occur whether they get the vaccine or not. And so we have to be very skeptical of any reports of some kind of autoimmune condition, because they're going to occur to people even without the vaccine. And so we need to be careful in that. And so when we look at the flu vaccine, for example, whether we get a neurological event or not, the estimated rate is 1 in 1 million people, or even greater than 1 million people. And so that means that 99.999% of people do not get any neurological thing. When you think about your risk for COVID, whether that be hospitalization, being sick for a long time, long haul symptoms, permanent effects, those are much, much greater numbers than that 1 in a million shot. And that's even a theoretical risk at this point.
Great. Thank you very much. Dr. Salazar, some people think that the vaccine is more dangerous than COVID itself, or the side effects of the vaccine are worse than having COVID. What's your response to that?
It's a phenomenal question, and I get that question a lot from my students and my paramedics. I wish to remind folks that at the end of the day, when you get this COVID-19 vaccine, you're not getting a virus. You're not getting a live virus or even a dead virus. You're getting little spikes. The protein, what these little proteins are going to do, they're going to elicit your body to create and mount an immunologic and inflammatory response, just exactly the same as you would for any other types of immunologic inflammatory responses like environmental allergies. What these inflammatory reactions are going to do, these immunologic responses, they're going to create some minor symptoms for you. And those are very short-lived. They're very minor and very tolerable. They can include low-grade fever, some body aches, perhaps a runny nose, nothing more than that. If you're asking me, are these more acceptable than the potential COVID-19 virus symptoms? I'm going to say to you, I would rather have these short-lived, easily treatable symptoms than the potential of having the scary COVID-19 virus types of symptoms, including acute respiratory distress syndrome, etc. So I'm not going to play my chances. I would rather go through these minor symptoms rather than risking the whole disease.
Definitely. Great. Thank you for elaborating on that. Dr. Ronna Miller, some think that the vaccine production was a conspiracy to make money. What do you think about that?
Well, the answer to this one is very short. That's just nonsense. If it were a conspiracy, then the entire world and the entire scientific and medical and public health communities, hospitals, patients, family members, first responders, everybody would have to be in on it. While it is true that, at least in the United States, the federal government has lent substantial financial support to the vaccine manufacturers, we should all be thankful that the resources were in fact available to conduct this research and to bring these vaccines to the community as quickly as they have been. Otherwise, the pandemic would drag on potentially for years and years. So yes, this has cost money. There's no surprise there, and there's no denying that. But it's certainly not a conspiracy. And again, we should be thankful that we've had the resources to devote to this so that we can bring an end to this global pandemic sooner rather than later.
Great. Thank you very much for elaborating on that. So Dr. Morchetti, some people say that they'll get the first shot but avoid the second shot because it sounds like the studies showed some more intense side effects after the second shot. Do you think that's a good idea?
No, that's not a good idea to avoid the second shot. So they are correct that in the studies, more of the side effects came after the second vaccine injection than after the first one. And we suspect the reason for that is because your immune system was trained a little bit after the first shot, but it takes a couple of introductions of you building the spike proteins for your immune system to get stronger to be able to fight off a full-blown COVID infection if you were to get one. There's a lot of other vaccines that we've had and our children take that also require 2 or 3 shots, the MMR, the HPV, the hepatitis series, Pneumovax, you name it, there's a lot of them out there. So this is no exception. It just requires a couple times for your body to see it to be able to be strong enough to fight it off. So if you just get one shot, but then you don't get the second one, you're likely not going to be protected or immune from catching COVID if you are exposed.
Perfect. Thank you. Dr. Brian Miller. Some are saying, well, I'll let everyone else get the vaccine first and see how it goes before I make my decision. What do you think about that?
Right. So my answer is twofold on this. First off, we have to get this vaccine. We have to protect our coworkers. We have to protect our families, our departments, our cities, our patients. This is our way out. The longer we wait, the longer we're in this. The longer that we have to sacrifice and chance more deaths, more hospitalizations, more overload on our system. And so if we all get the vaccination when we have our time, the faster we are out of this. Second part of this is about the greater good. This isn't just about us individually. This is about society. This is about protecting our neighbor. This is about herd immunity, getting us to a level of vaccination where we shut down this virus. And so once we get to a certain level, the virus activity drops in our communities and we are all thus protected more. When we worry about mutations and all those things, the more virus flowing around, the more likely those happen. We shut down this virus by getting this vaccine and getting it when we're appropriately timed.
Dr. Salazar, I've heard that some people have had allergic reactions to the vaccine. Is it safe to still get the vaccine for people with allergies?
While there have been reports of pretty serious allergic reactions to the vaccine, I got to remind folks these are remarkably rare. This is not something that occurs very frequently at all. Now, there's different types of allergies that people can be concerned about, but the run-of-the-mill environmental allergies or allergies to medications do not put you at any greater risk of getting these serious allergies with the vaccine. There are some ingredients in this vaccine formulation that you should be aware of, and those are reported to you at the time of vaccination. And so you should definitely go through those before taking the vaccination. Make an appointment with your physician, primary care provider to discuss any potential side effects or any of the ingredients might have given you trouble before. But I want to reiterate, the chances of you getting an allergic reaction with this vaccine are remarkably low as it is.
Great. Thank you for elaborating on that. Dr. Ronna Miller, we've heard rumors on the internet about the vaccine potentially causing infertility. What are your comments on that?
That's another question for which the answer is absolutely no, based on the science, especially for these particular mRNA vaccines. There is no scientific basis for that. And of course, all study participants and vaccine recipients will be studied moving forward into the future. But again, there is no science to support that. It is simply a myth.
And then Dr. Rhonda Miller. So let's say we all get the vaccine. At that point, can we get rid of our mask and take off all this PPE?
That's an excellent question. And there are a number of reasons why that is not a good idea. So the short answer is no. To reiterate what Dr. Miller already mentioned, full immunity doesn't occur until 7 to 14 days after the second immunization. So until that point, even after the first shot, you are not fully protected. Second, while the vaccine is 90 to 95% effective against your contracting severe illness, we do not yet know whether the vaccine prevents your ability to carry or transmit the virus to others asymptomatically. Third, no vaccine, not even the best, can be 100% effective for absolutely everyone. Fourth, there are going to be individuals, at least initially, who for medical reasons or otherwise cannot take a vaccine. Fifth, although there is no evidence for this yet, it is certainly possible that the virus could at some point mutate to the point that it escapes the vaccine, although again, to reiterate, there is no evidence of that. And finally, it's going to be many months before enough people in the community are vaccinated so that we have achieved herd immunity and have tamped down the virus. So until that happens, it's absolutely imperative that we continue all of our infection control and infection prevention measures by masking up, hand hygiene, physical distancing, limiting group gatherings, and all the other facilities and activities that we've been practicing for the past several months until we are at the other end of this pandemic.
And finally, have all of you either received or plan to receive your vaccine?
Yeah,
Yes.
Absolutely.
Great to hear. So in conclusion, Dr. Isaacs, do you have any closing thoughts or take-home points for everybody watching?
Yes, thanks, Lauren. Since the beginning of modern EMS, paramedics, firefighters, and officers have demonstrated commitment, dedication, and bravery each and every day. Never has that been more true than during this pandemic. You've always taken care of our community, and for the past 10 months, you've done so at personal risk to your own health. Now, it's time for the community to take care of you. This vaccine can help make sure that you're all here, along with your families and colleagues, to celebrate the holidays together in 2021. So, when you hear it's your turn, take the vaccine. Let's end this pandemic. Let's get our lives back. Until then, please stay safe.
And this concludes our session. I hope you all enjoyed hearing from this panel of experts who are working tirelessly to advocate for your safety and well-being. If you have any questions at all, please feel free to reach out via email at the bottom of your screen. And we thank you for everything that you do. Continue to be safe out there and appreciate your time listening to this.